Dennis presented to us with a respiratory infection. However, we have since identified numerous potential and actual problems pertaining to his current treatment plan. Today, various health professionals recommend alternative pharmacological and non-pharmacological therapies.
What are the problems relating to Dennis's pharmacological treatment in order of priority?
Well, amoxicillin and clavulanic acid is an inappropriate and unsafe drug choice for Dennis, considering his history of anaphylaxis to penicillins, and poses an actual risk.
Dennis is suffering from hypokalemia, usually due to a combination of kidney dysfunction, comorbidities, and drug-related treatments. Ramipril is contraindicated in hypokalemia and is therefore not a viable option, posing an actual risk. Furthermore, Dennis has a creatinine clearance rate of 10 milliliters per minute, indicating end-stage kidney disease. Ramipril should be seized when creatinine clearance is less than 15 milliliters per minute due to a risk of further renal injury. Additionally, Dennis's aspirin interacts with Ramipril, decreasing its hypertensive qualities, therefore posing the potential risk of poorly managed hypertension.
Due to Dennis's renal dysfunction, the use of metformin presents an actual risk of further damaging the kidneys and should be avoided in severe renal impairment with a creatinine clearance rate less than 15 litres per minute, presenting an actual risk.
Dennis's use of ibuprofen introduces a potential risk by interacting with aspirin, thereby reducing its antiplatelet and cardioprotective effects. This could be detrimental to Dennis as his hypertension and current weight are risk factors in the development of cardiovascular illnesses.
What are the non-pharmacological issues we've identified in order of priority?
Dennis's diet consists of food high in saturated and trans fat, which is exacerbated by his lack of participation in regular exercise. This presents an actual problem with these lifestyle changes resulting in obesity and the development of type 2 diabetes. Dennis's BMI is 34, representing obesity, drastically increasing his risk of coronary artery disease. Additionally, hypoglycemia can cause damage to blood vessels, nerves, and contribute to kidney disease. Dennis consumes 2 to 3 glasses of red wine per night, posing an actual risk to his health. Excess alcohol consumption can cause significant weight gain, aggravating hypertension and increasing the risk of attaining complications associated with type 2 diabetes.
What about Dennis's mental state?
Following the past of his life, Dennis is struggling to find motivation and improve his quality of life. This presents an actual problem and is clear through his lack of exercise, poor dietary management, common symptoms of depression. Initially, Dennis is reluctant to take new medications, presents a potential problem in the implementation of new treatment as compliance issues can cause alteration in therapeutic benefits of treatment.
We will now recommend pharmacological modifications to increase the quality, efficacy, judiciousness, and appropriateness of Dennis's medication. These are fundamental objectives of the National Medicines Policy that seek to attain the quality use of medicines.
Erythromycin should be prescribed instead of amoxicillin and clavulanic acid. Erythromycin is not contraindication or cautioned in the presence of Dennis's severe renal impairment, making it a safe drug option. It is indicated for upper and lower respiratory tract infections and thus is inappropriate in regards to John's presenting issue. Overall, we believe that this is a sensible and judicious drug choice that will be effective.
But Dennis takes simvastatin, which interacts with erythromycin.
Simvastatin should be seized until the course of erythromycin is finished due to their interaction increasing the risk of rhabdomyolysis.
Dennis did express that he wished to try alternative treatment.
Alternatively, or in conjunction with antibiotics, Dennis may like to try a combination of angiographis and Siberian ginseng to reduce symptoms. Studies have shown that this can improve respiratory infection symptoms, including fever, coughing, sore throat, and headaches within 72 hours of consumption. As an alternative to Ramipril, we have prescribed clothalidone, which is a moderate diuretic, as well as metoprolol, which is a calcium channel blocker. These drugs are safe and appropriate as they are not contraindicated in hypokalemia or cautioned in renal impairment and do not interact with his other medications. Clothalidone may also assist in lowering Dennis's elevated potassium levels. Furthermore, these medications will be effective in managing Dennis's blood pressure, together reducing blood volume and causing mild vasodilation, making them the most judicious choice.
Metformin should be seized. Dennis's diabetes was induced by recently altered lifestyle changes, therefore we suggest making alterations in diet, exercise, and alcohol intake to try whether this is effective in managing his hypoglycemia. If ineffective, we will consider prescribing linagliptin, which is not cautioned in renal impairment and will increase insulin secretion while reducing glucagon production. This medication appears less effective than metformin, however, is more appropriate and safe in light of Dennis's renal function, making it a more judicious choice.
Ibuprofen reduces the antihypertensive effects of newly prescribed metoprolol, which may result in poorly managed hypertension. Therefore, we have swapped ibuprofen for paracetamol, which has analgesic effects, is easily accessed over the counter, and will not interact with Dennis's other medications.
And what are some non-pharmacological treatments?
As Dennis's metformin treatment will be stopped, he will need to work alongside a dietitian such as myself to strictly monitor his carbohydrate and glucose intake when managing his hypoglycemia. This, paired with exercise, which increases insulin absorption, will benefit the management of his comorbidities. These dietary changes will also help Dennis manage his cholesterol while simvastatin is ceased. Dennis should reduce his intake of foods high in potassium, such as bananas, due to his elevated potassium levels and decreased renal function. Achieving these dietary changes may be challenging, therefore we recommend Meals on Wheels. This organisation provides nutritiously balanced and subsidised meals, making adapting to these new lifestyle changes convenient and affordable.
Dennis should consult with a psychologist like myself to discuss potential non-pharmacological treatment plans to improve his current symptoms. Other options include engaging in cognitive behavioural therapy, a short-term treatment used to identify a person's behaviour and pattern of thinking, adapting to their needs and assisting them to improve their thoughts and quality of life. If Dennis does not wish to consult a psychologist, he may contact mental health organisations like Beyond Blue. Pharmacological treatment options are a second line of treatment, however, the avoidance should be prioritised considering Dennis's renal impairment. Dennis is reluctant to take more prescribed medicines, which could be due to a lack of education and understanding. We advise that our pharmacist, Abby, discuss the commencement of a Webster pack whereby each of his medications are organised into a sealed weekly calendar pack with attached information and support regarding his medication, alleviating anxiety and increasing understanding.
What's our plan for Dennis moving forward?
As previously stated, Dennis' medication will change to the following. These medications will be effective in managing Dennis's illness and are safe to take in combination in light of his renal function. These pharmaceutical modifications are the most appropriate and judicious choice, adhering to the quality use of medicine. Changes to diet and exercise made necessary with support will help Dennis manage his comorbidity. Finally, Dennis should be referred to a psychologist to help him move forward after the death of his wife.